Hello, everybody, and thank you so much for joining me for today's CMA Showcase video. Today, I'm joined by CMA member Dr. Christopher Koumides. Christopher, welcome. Thank you so much for joining us.
Thank you very much. Thank you very much. Nice to meet you.
Yes, it's fabulous to meet you too. We're really proud to have you with us here at the CMA. And I was wondering if you can tell our viewers and our listeners a little bit about the work that you do and a little bit about your background and just sort of introduce yourself, if you will.
Okay, so I have a bachelor degree in naturopathic medicine. I have my doctorate about in naturopathic medicine, and I have my specialty in trichology.
Right. Okay. That's
Yeah.
superb. Thank you. And obviously, quite a lot of our viewers and listeners won't necessarily be familiar with naturopathic medicine. So, what we need to do is we need to actually explain a little bit about what that actually means. So, if somebody's coming to see you and they want to see you as a naturopath, what could they
Okay.
expect? What is naturopathic medicine?
Okay. What does naturopathic medicine do? Okay, naturopathic medicine is a system that uses natural remedies to help the body and heal and heal itself. So it embrace many therapies. So it's neutral counseling with naturopathy, and the naturopathy is like the name is natural healing. So we are not homeopathy. Is a very big difference with that. We are doctors, NDs, naturopathic doctors. We are not MDs. We're not medical, but it's like the same. It's like the same, but without the prescription, the drugs.
Right.
Yes.
Okay. Yes. Also, I think there is a difference insofar as a conventional medical doctor tends to really be dealing with symptoms once they've arisen, whereas in complementary medicine and particularly in naturopathy, we're looking at ways of keeping our patients well. So, yes, of course, we can work with people once pathologies have arisen, but of course, there is an emphasis, isn't there, in the work that we do in the field of complementary medicine on preventative medicine and healthcare as opposed to illness care. Would you agree with that?
Yes, I agree with that. Naturopathic medicine is like the GP, but the GP gives the treatment by the symptoms. Have the holistic method with naturopathic medicine, and we treat seriously autoimmune diseases, chronic diseases, musculoskeletal diseases, and all of that, but with more natural ways. Like we have very special techniques is radiology. Radiology is from the eye. We treat from the eye and we diagnose the diseases with this machine, and we understand what is the holistic problem, what is the problem by the organs of the system and not by the symptoms.
Yeah.
So this is the main difference about the MDs and NDs. But
Yes.
I agree with MDs because we are friends with MDs.
Of course.
Yes, we cooperate.
Yes.
Yes.
Well, that's right. And that's why what we do is complementary medicine, because obviously each side has great strengths. And so we're not sort of fighting against, their side, if you like. And it's I find it very interesting. I don't know if you noticed this, that many more doctors, conventional medical doctors, are actually starting to embrace complementary medicine and natural healthcare,
Yeah.
holistic health techniques, particularly in the field of lifestyle medicine. And
Yes.
naturopathic medicine sort of really kind of plays into lifestyle medicine as well. So it's a very interesting, the way things are
Yes.
developing is very interesting. So the other
Yeah.
thing I understand, though, that you get involved with in your practice is trichology. So I was just wondering if you could tell our audience a little bit about that. What does that actually mean? What does that word that they may not have come across before? What is
Okay.
that about?
What are the duties of the trichologist? Is trichologists what do? Specialists working in the field help people with issues such as hair loss, hair by only scalp and scalp psoriasis. We treat a serious problem with the scalp and the hair. So we have many techniques like the non-invasive technique in PRP. PRP is like a treatment, natural treatment on the head. So with this way, helps the people to have a very serious problem with the hair. and so can help with this treatment, because this treatment is have two main positive results. Is
Mm.
natural, and the results is very, very good, because PRP is non-invasive, so have no pain in the head,
Mm.
so it's very, very important,
Yes.
and the result is very good.
Yes. And so when we're talking about PRP, I presume you're talking about platelet-rich plasma. Is that correct?
Yes,
Yeah. Okay.
platelet-rich plasma.
So
Yes.
can you maybe talk a little bit about where's the source of PRP, platelet-rich plasma? How do we get that? Where does that come from for the patient to actually then be able to be treated?
Do you know the procedure?
Yes, I just wanted you to tell the audience a little bit about how we derive platelet-rich plasma.
Okay, the plasma is inside the blood. Okay, is the white blood cells. It's WBC. So we have in the beginning, we must take the blood collection.
Mm-hmm.
Okay, and after that, we have the centrifuge.
Yes.
Okay, and with this technique, we can separate the red blood cells with the white blood cells,
Mm-hmm.
and we need the rigid plasma. The rigid plasma is the middle of the RBCs and YBCs,
Mm-hmm.
and we can collect the little one in the middle of the blood, and we take that, the plasma, the rich plasma, because the rich plasma is a positive of that. We can treat and the teeth and the derm and the bones and the muscles.
Yeah.
We use all of specialties in medicine. It's
Yes.
not only for the hair. So
Yeah.
yes, it's
That's right.
fascinating.
Yes.
Um,
Yes.
the plasma I call that
Yeah.
the plasma is the god of serum. Is
Yes.
very, very good for
It,
your head.
it it really is. It's a fascinating thing. It hasn't been around that long, but
Yeah.
it's very, very interesting and very, very effective. And what I love about PRP treatments is the fact that
Yes.
because they're derived from the patient's own tissue, their own blood, what that means, of course, is there's no chance that they're going to reject that therapy.
Yeah.
It's
Yeah.
treated them with their own, essentially, a derivative from their own blood, isn't it? Which is
Yeah.
really interesting. And so I've certainly seen people with, really very, for example, very severe joint damage,
Yeah.
where there has been, they've been using PRP and being injected for that. And it's
Yeah.
very interesting to know that it works so well on the scalp as well. And also, as you quite rightly say, dentally as well, with teeth and so on. So it's a fascinating topic. It really is. I'm sure you're getting brilliant results. So I was going to ask you, the problem within complementary medicine is that we often face a lot of criticism from pseudo-scientific skeptics who say, oh, yes, well, all that stuff that you people are doing is not really real science. So can you speak to that, please, Christopher? Can you actually tell people if they sort of are a little bit doubtful, is trichology a real science? Is there any research behind the work that you do?
As a naturopathist and trichologist professions, for more people, tells is not scientific proved, and is not like medicine.
Mm.
But I can approve with my degrees and with my association, Pan-Cyprian Naturopathic Association, because my country in Cyprus,
Yeah.
and we have a big problem with that with MDs. But I can understand what is that to make the problem, because MDs is doctors, and we are doctors too, and we study the same things. But the main difference, we are not allowed to use pharmaceutical remedies like the drugs.
Yes.
I believe drugs is good for some reasons, like the thyroxine, like for diabetes.
Insulin, yeah, things like
Yes,
that.
okay, okay,
Yes.
all of that. But we have some people to treat, and we have many ways, many natural ways to treat that, because it's not the solution every time is the drugs. is not right because they're poisoning in the blood. And this is a big problem because if you notice that most people in 60s and 50s drinks a lot of drugs because they have many serious problem in diseases, autoimmune diseases, chronic problems, and all of that is from the drugs. Because if you drink, if you take drugs, you have in potential in the future many problems from the drugs.
Absolutely, people are definitely. It's a good thing
And
to do to try to stay aware, stay clear
and
of drugs, unless you
and
absolutely cannot live without them.
and one drug of this is cortisone. In Cyprus, we use very big problem. We have very big problem with cortisone, and I
Mm.
can't understand. I
Yeah.
can't understand why they use it.
It's funny, isn't it? They do in France as well. It's a very strange thing. It's a mystery to me as well. So yes, when there are so many other ways of actually addressing certain issues. There is a place for a prescription of cortisol when it's actually warranted. But it's not always warranted, and yet these prescriptions are handed out. It's not a good thing. A little bit like the overuse of antibiotics, for example. Yes, of course,
Yes.
antibiotics save lives.
We are
But
we're the first country to drink to take the antibiotics. But I am proud because the first country in the Europe, Germany, the Germany approved the naturopathic medicine and in regulated by the country, by the government. So
yes,
this is important, and we try the same thing in my country a little bit. But the government is very difficult to understand this
yes,
because we're led from
yes,
child age to go in the medical doctor.
yeah,
So it's difficult to understand right now what is the naturopathic medicine? Is medicine, and
yeah,
what is that?
yes,
People can understand it, can read for the and learn what is the naturopathic medicine, because naturopathic medicine is very old technique and old medicine studies. It's
yes.
not right now.
That's
It's not
right.
born right now.
Mm. Yes, it has a great long history of use, actually. Right going back to the German Heilpraktikers, for example. That's sort of
Yes.
where a lot of this work comes from. So, Christopher, I'd love to chat with you all day if I could, but I know you've got patients to
Thank
see,
you.
and
You
I've
too.
got more interviews to do. So, just to close now, what I wanted to do, and we can always bring you back on in a future date, for a further chat. But just to close now, anybody watching this or anybody listening to it on when they listen to it as a podcast, how would they go about finding you? If somebody's thought, gosh, I'd love to explore that PRP, or I'd love to come and see Dr. Koumides for naturopathic help and so on. How do they find you? What's the best way for people to be able to reach out and make contact?
Okay. I have in Google, if you write Dr. Christopher Koumides NDTR, TR is for trichologist. I have a very good 3D modeling explanation with the hair shaft in my webpage, and you can play with that, and you can write and you can read for me what is my studies, what is my associations, and all of that, and you can close appointment from there. And I have my Instagram, of course, with very good content. And you can write for all of that. And naturopathy and trichologist. If you have any questions, I can answer by the Instagram. So yes.
Fantastic. So it's easy enough for people to find you. Also, I just want to say for anybody watching this video, if you look at the show notes underneath this video, you'll actually see Dr. Koumides' contact details as well, and details of his website and Instagram. So, Christopher, thank you so much. It's been
Thank you
really
so much.
no, an absolute delight. And thank you for talking to us today. And as I say, I think we need to bring you back on for a longer chat. But for your showcase video, this has been
Of course.
amazing. So thank you so
Of
much.
course.
I
Thank
appreciate
you
it.
so much.
Thank
Thank
you.
you so much.